Assalamu alaikum and very good afternoon to all of you. Give your heart attention it deserves. The heart is a remarkable muscular organ that pumps throughout our bodies. Of course, it is roughly the size of the clenched fist and weighs about 1 pound. Our heart beats around 100,000 times daily, tirelessly circulating blood, supplying cells with oxygen and nutrients, and removing waste products. Yet, despite its incredible capabilities, heart disease remains the leading cause of death, even though much of it can be prevented. You'll be surprised to know that 80% of the heart disease is preventable. So, caring for our heart is paramount, especially considering various health challenges that can affect it. I'm Dr. Asyia Nabi, General Practitioner and Assistant Medical Director, with you from our official social media platforms. I have something very important to share with you. I would like to invite my speakers on this webinar today, and with that, I will also share the information which is very important for all of you, some valuable gifts for all of you who are here to join with us today. Let me introduce my first speaker on this webinar today. We have uh, Dr. Ahmad Al-Jeboury, who has more than 20 years of experience in cardiology and interventional, as a cardiologist as well as interventional cardiologist. Uh, Coronary angiography, stenting, and heart catheterization, from prevention to care. He has everything on board with more than 20 years of experience. Dr. Jeboury has joined us from Prime Hospital. Welcome, Dr. Jeboury.
Thank you. It's a pleasure to be here joining other colleagues.
Thank you. I have with me now Dr. Suma. Dr. Suma Malani has more than 20 years, has more than 2 decades of experience in the cardiology. Something very important to share with all of you is that she has area of expertise in, in also authored more than 40 research papers, textbooks, chapters, and won several awards for her work in cardiology. She has more than a decade of experience treating, educating, and information session about chronic patient as a consultant. She has joined us from Prime Medical Center, Burjuman. We have now third speaker with us today. We have Ms. Saba. Ms. Saba is a clinical dietitian. Her area of expertise is in holistic therapeutic nutrition, corporate wellness, weight management, women health, and everything and anything related to diet, specifically diuretic health, health awareness as well. With more than 15 years of experimental learning, she derives deep pleasure in bringing good health back in her patients through a sound holistic approach to lifestyle changes in behavioral and food modification. So all of you, welcome to the program today, and thank you for, it's an honor for me to host today's webinar with all of you.
Thank you very
Thank
much.
you, Dr. Asyia.
Pleasure being here.
Before I begin with this program, so I would like to tell all my audience who are here with us that throughout the month of September, Prime has launched something very important, which was about preventive health screening through AI community health screening programs. Now, today you all have an opportunity to win this test. We are going to share shortly in the comment box about it. And you just have to do one thing. You have to click on the link and answer your questions. In a day, you will receive a complimentary health coupon, and you can go to any Prime Medical Center and check your risk, whether it's mild, moderate, or severe risk in coming time or in coming future. So do not lose this opportunity with that. I would like to really start with Dr. Jeboury first. Dr. Jeboury, my first question: in the current times, what are the most common heart issues in UAE?
Thank you very much. I would rather rephrase the question that what we are really facing in our practice. In our clinic, we are still facing patients related to ischemic heart disease, coronary artery disease. We are still facing also a large number of people who are coming with palpitation, The majority of them are having a minor, rhythm problem, some extra systole. We are facing people who are coming nowadays, specifically with some other forms of arrhythmia now. They are, what I'll say, they are much younger than we used to face. We are having a lot of people who have a major heart attack, which are more younger than we used to face. And this is things is making the majority of the cardiac patient. And regarding the inpatient, most of the cases are having ischemia, coronary artery disease, and some heart failure. It's all over the worldwide that the cardiovascular disease is the major cause of mortality everywhere. Even with the 2019, when there is a major upstruct of COVID, despite the mortality of COVID, but it never reached to the cardiovascular mortality. Yes, we are getting better compared to the statistics in the 60s and the 70s of the old century, with the all improvement in the technique, approach, guidelines, treatment, but still the major killer is the cardiovascular, or let's make the phrase more generalized into the atherosclerotic group of diseases are still dominating the picture here in the UAE and I think everywhere.
Thank you, doctor. So, currently, so a lot of questions around it that cardiovascular disease. I would like you to explain a little bit more that what should people understand when we say cardiovascular. What is cardiovascular for anyone to understand?
Yeah, the cardiovascular disease, nowadays, a lot of people, they are measuring that into atherosclerotic disorder. We have to know that actually the heart is an organ like any other organ of the body. It has to be supplied by blood. The blood has to be adequate for the heart to function normally. The heart is the major pump of the body. So when we say cardiovascular, most likely we will specify into an atherosclerotic coronary artery disease. That means we are facing a problem where there is limitation of the flow of the coronaries, either a form of abrupt incident like acute ischemia or gradually progressive like chronic ischemia, which will ultimately end up into decrease of the heart flow and then subsequent complication of infarction, ischemia, heart failure. And this is all related to the major known risk factors, which we are always emphasizing on, like hypertension, diabetes, smoking, hyperlipidemia, stress, life conditions, decreased mobility. All these risk factors are culminating to increase atherosclerotic complication and ultimately affecting the heart. And now even the brain is considered part of the spectrum of the atherosclerotic conditions.
Absolutely, doctor. That's quite correct. And with that, you have elaborated all the risk factors which can lead to heart disease eventually. Dr. Suma, let us at least tell our audience some of the risk factors. Why does that happen? Like, why blood pressure can lead to heart diseases if not controlled? First of all, what is normal blood pressure, and what people should know if they are not going to the doctor, if they are not really bothered about it? What is important to know about blood pressure and how high blood pressure can lead to heart diseases?
Normal blood pressure for a normal healthy individual is 120 over 80 millimeters of mercury. But we allow various readings as far as the individual is healthy. For someone who's very young and very athletic, a blood pressure like 100 by 70, 100 by 60 may be normal. But for someone who is elderly, who is a diabetic, a blood pressure above 130/90 is also considered as hypertension. Generally, for the general population, blood pressure of more than 140/90 is considered as hypertension. But for individuals who have other risk factors like diabetes they have had a previous heart disease or heart attacks, we would like to keep the blood pressure lesser than that, lesser than 130/80. Blood pressure is very dangerous. Mostly, it is does not produce any symptoms until it leads to some kind of target organ damage, like either a stroke or heart attack or some kind of peripheral vascular disease. So it is important one should check their blood pressure to know how much is it, but not wait for symptoms, because blood pressure is hypertension as such is mostly asymptomatic. It does not cause any symptoms until there is some health damage. But blood pressure can lead to heart attacks, heart thickening of the. Can you hear me?
Yes, doctor, we can hear you. Please go ahead.
Yes, so high blood pressure can lead to heart problems like heart attacks, thickening of the heart muscle, what we call cardiomyopathies, and it can lead to arrhythmias. It can lead to peripheral vascular disease, that is the vascular disease of the legs, abdomen. It can lead to stroke and other diseases as well.
I was on mute. Thank you, doctor, for that. I hope people can understand that smoking is really dangerous. The other thing which is important as far as the life, heart risk history is concerned, a lot of people are not very clear about what is family history, how it is increasing the risk of heart diseases overall. What is that particular thing people should know and evaluate their own family history and go to the doctors early rather than waiting for the disease to happen?
Most diseases are actually run in the families. Genetics play a very important role. But the commonest heart problems, like coronary artery disease, what we call heart blocks or heart attacks, although they're genetically dependent, the majority of them are influenced by lifestyle or not genetics. But there are other diseases like cardiomyopathies, that is where the heart dilates or heart dysfunctions, or arrhythmias, which are basically depend on the genetics. These are strongly influenced by genetics sometimes. But the commonest heart diseases, like I said, heart attacks, or peripheral vascular disease, or stroke, these are mainly lifestyle disorders, although there is a certain genetic role play in that. But even people who have strong family history, like a heart disease in mother or father or a sibling, can prevent heart disease if they follow a strict food lifestyle. So genetics do have a certain role, but not entirely affect a person's disease outplay.
Thank you. So let me ask Saba. Saba, what is the connection between diet and heart health, and why is it paying attention to our eating habits essential things?
So, Dr. Asyia, we know that now doctors have spoken about how the incidence of the cardiovascular disease have been increasing over the past years, even though there are a lot of been changes. Likewise, there is changes in the lifestyle also. So, the probability of cardiovascular diseases or heart ailments are correlated directly with your diet and lifestyle, and sleep pattern is also important. So generally, we have seen that people who are used to eating excess amount of sodium laden food, red meat, high intake of aerated drinks, low amount of plant based diet, less amount of fruits, less amount of fiber, inactivity, irregular sleeping patterns are at a higher risk of developing cardiovascular diseases slowly and gradually over a period of time. So it is a very important triangle, your heart, your lifestyle, and your food pattern. How are you connected? It makes a big difference on your cardiovascular risk factors.
With that, I have one question. Probably, he's loving the program. Thank you. Omisor for writing back to us. He has some lot of questions, I believe, for all of us. How to avoid the high blood pressure? I think Dr. Suma has already answered that. And are not there any particular food to eat always to get good blood pressure and to be safe from heart disease? About this you can take. And what are the signs of cardiovascular disease? Maybe Dr. Jeboury can answer this as well.
Yeah, that's very nice of ask the lady. So if we can go to how to avoid this high blood pressure. Now, unfortunately, if we go back to earlier recommendation, the earlier recommendation has focused that you have high blood pressure, even the previous guidelines, go with the diet, try. So generally, we have a few rules to follow up. Mainly, we depend on stopping smoking, reducing alcohol intake to one drink for a lady, two drinks for a male, reducing the sodium intake, regular exercises, and all this stuff. But unfortunately, we have to know that most of the hypertension, if we classify it now, we say it about 95%, we call it essential hypertension. That is no cause for that blood pressure. We have to know that this is a polite, explanation of our inability to define the cause. Despite this regular dietary or lifestyle changes, I think medical follow up is vitally important, and starting the treatment is vitally important because nowadays we have a very strong evidence that controlling the blood pressure to even lower level can prevent heart attack and brain attack and all these problems. Yes, it is necessary to follow up a healthy diet of, like I mentioned, alcohol, smoking, regular exercises, reducing sodium, reducing potassium, but follow up, controlling the blood pressure, starting treatment as early as possible. It's vitally important. Unfortunately, there is still we are facing patients with the concept of, the old concept. They consider that increasing blood pressure with age is representing a normal physiological process of aging. That theory has been recently and strongly refuted. Controlling the blood pressure is vitally important. Strongly controlling the blood pressure and starting medication is vitally important to prevent a life threatening complication. I think diet and lifestyle alone should never be focusing on. We have to add an additional thing. And for the rest of the question, I sorry, I just forgot the rest of the question.
So,
The if we can see it, like what are particular food to eat to have a good blood pressure. Again, we have to go to reduce the amount of the bad food. The bad food, you can consider that reducing the red meat, a modification of alcohol, avoiding the fried food, try to avoid food cooked in palm oil, coconut oil, allow excess amount of fruits and veggie, allow an excess amount of legumes, allow to have a good amount of whole grain. These are vitally important, not only for the pressure, but for the healthy lifestyle. What about the signs of cardiovascular disease? That's really a very tricky question. I can give you now example about hundreds of cases we are facing every week when a major heart attack was mistakenly considered as dyspepsia or some chest infection or not. The most important thing that that we have chest pain, shortness of breath, palpitation, or dizziness. But I don't think we should always try to, depend on these. We should always keep a very high suspicion level of heart attack. I think it is visiting the emergency department, doing the necessary basic test is vitally important. I have been seeing every day, like I came in the morning to the hospital. The emergency physicians, they just took me to see one patient. You can see a gentleman, he's well dressed, He had put his tie, he went to work, he had a chest pain, he came back sitting in the emergency with nothing happen, anything? No. There is a mild pain, non-smoker, nothing. You just go to examine him, and then you find out the patient has suddenly, severe basal crackles. Uh, you have to know that depending too much on chest pain and signs can be totally misleading. I have seen a lot of patients have major heart attack. They spend a couple of days waiting for the stomach upset and antacid. I have seen a major heart attack who went to the dentist and he got some tooth extraction. I always advise the people to have a very high suspicion. It's not harmful to go to the emergency. Just check it, please. We do have a lot of tools. We could do ECG, we could do cardiac enzyme, but we should be very careful about it. I always tell the junior fellows here that 2 or 3 major signs should always ring a bell. Any pain with sweating, specifically drenching sweating, any pain with nausea, any pain with dizziness, this is significant pain. Any pain that brings a patient to the after 1 p.m., 2 p.m. to the hospital, this is a significant pain. We should not ignore it. Okay,
Thank
so always
thank
we should keep a high suspicion and always play on the safe side. Go to the emergency, have a rapid check, half an hour, everybody will be happy.
Thank you, doctor. That was really important, specifically when we are in current times. Dr. Suma, I have definitely a question, early symptoms of heart damage, but let us talk a scenario based, like, because, I'm a general practitioner and I see a lot of people of different age groups, and there's always a concern. Like, suppose we are doing an annual health check, and a general practitioner can see some mild changes where blood pressure is normal, sugar is normal, but some mild changes in the ECG. And now, because ECG do have some printable write-ups also, which sometimes shows ST elevation, and you can generally Google. Google is always available to interpret these things. And patient is otherwise fine. There's no risk factor. In such cases, what is the advice for patient to do? Of course, doctors will take their call, but for patients who have this ECG reports in hand, uh, how serious is ECG report for the patient to read and interpret?
ECG is never meant for patients to read. It is to be interpreted only by doctors. But if somebody wants a health checkup, or somebody is asking what are the earliest symptoms of heart getting damaged, the earliest symptoms will be chest pain, breathing difficulty, palpitations like heart beating very fast, or there may be some giddiness, dizziness. These are usually the earliest symptoms of the heart disease. But if somebody does come to a clinic and they've taken the ECG and there are some changes, then depending on the symptoms, one should get a cardiac troponin test. That is the enzyme that the heart releases when there is a significant damage to the heart muscle. So that is a very specific and very sensitive test. So if somebody does not have a positive troponin or is not having a heart-related problem, but there are still some ECG changes, then I would suggest them to go for a screening cardiac stress test like a treadmill test. The treadmill test is very specific. That means when a treadmill test is negative, 95% of the time that the patient does not have a significant heart disease. So it's a very specific test, and it is what we commonly use as a screening test to screen the patients who have had some kind of ECG changes. Even if they do not have ECG changes, everybody above 30 years should have a stress test done at least once a year.
And how do we do this stress test? What is the general preparation for that if anyone wants to walk into the clinic and would like to go for stress
Yeah,
test?
it's a pretty much walk-in test. You do not require any fasting, or we sometimes tell them do not eat because they cannot walk on a full stomach. We usually say do not smoke, do not have coffee a couple of hours before the treadmill. Otherwise, there is nothing else. Anybody can just walk into the clinic or a hospital and get the treadmill test done. It takes exactly 15 to 20 minutes. We connect the ECG leads to a person's chest and put them on the treadmill machine, and we ask them to walk and increase the stress at a graded level while we monitor their ECG. So when the heart is stressed to an adequate level, if there are blocks, if there is any heart problem, that we can see in the ECG changes in the monitor. And that's why we pick up heart problems.
What is the outcome of treadmill test?
Outcome in the treadmill test usually is negative or positive. Negative means there are no significant ECG changes during stress. Positive means there are significant ECG changes, and based on the person's probability of risk. The patient is at a low probability of a heart disease, I might ask for a CT angio. If a person has got a high probability, significant risk factor, then I will just send them for a coronary angiogram.
So if there is definitely a positive test, that Dr. Jeboury, probably we will send the case to the hospital and we'll order for the CT angio. Is there any specific precautions to be considered before CT or angio, or it's always emergency procedure, or it can be taken as elective as well?
Preferably, the CT angio, we have to understand, is an elective procedure. We don't go for emergency. Whenever there is emergency, we'll go for conventional angio. It
Yes.
means something critical. We can interfere. We can see a significant block. We go to fix that block. We put a stent and everything. Now, the CT coronary, as Dr. Suma usually when the suspicion is low, mainly, ECG changes are not specific. The guy has no major risk factors. We can't do the CT angiography. And you have no CT angiography, it needs a specific preparation. First of all, we have to be sure the kidney function is good because we are giving a contrast. And probably the contrast which we give in CT angio almost double the amount we give in conventional angio. And second point, the heart rate should be a little bit slow because we have to follow up this contrast to go through the heart. So I believe that elective angio will need a very good preparation, a very good cooperation, a specific patient selection, low profile. Otherwise, it will be more misleading and it can delay a necessary life-threatening procedure.
So, doctor, when you are doing angiographies and you suddenly find that there is a block, so what is the next step when the patient is there? I'm sure that he is not, he's awake, and we want to take some decision on spot. What is the next step we generally consider at that point of time when a doctor sees the heart block?
Usually, when we see the heart block, we already, before we take the patient there, we have a background about him. We see the heart enzyme, if they are elevated. We have done an echo and see that is the heart muscle region corresponding to that artery is compromised in action. The enzymes are rising. There is some electrical instability. So most of the time, and we see the lesion, which is significant lesion, more than 80% and sometimes 99%, we will proceed immediately. And the patient is always awake. We may give a bit of sedation, but we always go immediately and try to fix that lesion. Simply, we go with what we call it angioplasty, that we go with a small device, dilate and fix. And most of the cases, it will not take more than 15, 20 minutes in most of the cases. And that is totally, very rewarding because it will immediately relieve the symptoms. It will stabilize his condition. And most of our patients, like 95%, they will be sent home one day after the procedure.
Oh, so one day after the procedure is important. So I'm sure that while in the hospital, they are referred to the ICU for monitoring and thing. But in case of certain mishaps post procedure, what are the immediate complications we can expect happening?
The complication, we used to have complication when the first procedure was introduced in the late 70s. And in the late 70s, the concept of the procedure was only ballooning. There was acute closure. There was acute infarction. Now we have been doing, like, since Prime Hospital has been opened for almost 10 years, we have never had any mishap. Now our technique has greatly improved. We have a huge backup data. This data will show us the guidelines, the protocol, the appropriateness of the procedure, the device we are having, the stent we are having is totally up to date. I have never met any mishap for the last 10 years. Very rarely you could have a local from the entry site, a mild bleeding, because we have to give a lot of blood thinning agent and a blood antiplatelet to be sure the blood flow. This is happening very mildly, but we rarely have any mishappening because the tool nodes and the devices used are really top technology available. We have never had any acute closure. We have never had any major problem. Now there is a lot of advances how to deal with the calcified lesion. We have the specific tools, tortuous artery, bifurcational, left main. I think with the major advances that has been done in the field, we rarely face any problem like we used to have it 10, 15 years ago.
Thank you, doctor. That was very elaborative. So now the next step is probably when he's staying in the hospital, we will definitely ask our expert dietitian to share some health tips while he's discharging the next day. So Saba, what you will do in that case? What is the recommendation for diet and lifestyle from your end?
Doctor, once the patient has been discharged from the hospital and otherwise also, we have to keep a close check apart from the medications and the follow up with the doctors. We have to keep a close eye on what food and how the food has been consumed. Often, for a couple of initial days, they come back to a healthy eating pattern. They come back to a healthy eating pattern where they are restricting on foods, they are restricting on processed foods, a lot of salt, sodium food. But later on, gradually they will get into the process, okay, because it's been a while and they are doing good. So the idea is to make them understand that if we can control our eating patterns well within your limits, try to limit your saturated fats, try to limit more than that the trans fat which is coming in from the bakery foods, the processed and the cured meat which we are often exposed to these days. Try to include a plant-based diet and healthy protein, when I say, I mean, if you can preferably have plant-based proteins from legumes, lentils, lean meat, lean poultry. It is advisable to have good amount of protein to keep your body in a good muscular state also. Reduce and restrict on as much as carbohydrates, simple carbohydrates, and extra drinks and colas, etc. And take care of your heart, because no, I mean, many a times I see patients, they after an angioplasty or a few days later, they will join gym and they want to do everything possible now. They have to take care, but they don't have to overdo things. Don't get overexcited. Be gradual. Take care of your medications. Regular follow-ups to the doctors is equally important, and following a well-balanced plan is very important.
Thank you. Dr. Suma, I just want to ask, suddenly someone is in the mall and collapses. How to differentiate whether this is cardiac arrest or heart attack for general people to know?
Yes, heart attack usually very seldom patients just collapse like that. Very seldom. They experience some kind of discomfort, chest pain, usually central chest pain, radiating to your throat or to your left arm. They may be sweating. They may have some breathing difficulty, a feeling of unwell. They're feeling unwell. They might have some dizziness and giddiness. These are the usual symptoms. But in women and elderly, even atypical symptoms can be there, like just feeling a bit of nausea or back pain, abdominal pain, or general sweating. These kind of things also should be seriously considered as symptoms of heart attack, especially if they have had a previous history of heart disease, or if they're elderly and have some comorbidities like diabetes and hypertension, etc. So seldom patients just drop down when there is a heart attack. Cardiac arrest, however, can happen suddenly. Patients do, just collapse, and in those cases, how do you make out it's a cardiac arrest? You have to check patients whether patient is breathing or not. You can observe their chest, whether it's rising and falling. You can check their pulse. You can just turn a patient's head to the side and palpate for the carotid artery in the neck. And it's always good to call for help whenever there is someone who's unconscious or not responding.
But at least people in this country, we are blessed to have ambulance just a minute away, and people should know basic CPR. That's how we differentiate between cardiac arrest and this thing. I have just similar one question on the screen, Dr. Suma. Jasina is asking what to do when blood pressure goes high and suddenly gets a pain in the chest.
Chest pain should always take somebody to the hospital. That is the only thing. Chest pain should not be ignored, should not be presumed to be something else. When there is chest pain, it's always better to get to a hospital or a clinic to just do an ECG and let a doctor have a look. High blood pressure, of course, blood pressure usually never suddenly goes up unless there are medical conditions which can cause sudden rise, like endocrine disorders and all that. But usually in general population, blood pressure starts slowly, and then when it's untreated, becomes very high. So when somebody notices high blood pressure, then it is time to visit a doctor and check it up and take medicine for it. There are no home remedies. No home remedies advised for either high blood pressure or chest pain.
Now, Suma, one question. Your article is also in the newspaper about recent rise in last 2-3 years about young men having heart attack. Is this because media is now everywhere, or it used to happen before as well? Specifically, people going to gym, they are active. They are very active. In fact, some of the media stars also, and suddenly we see that they are no more. Anything which you would like to share information with us?
Yes, like as I've said in the article, heart attack is the result of complex interplay of risk factors. Genetics, lifestyle, what you eat is extremely important. Your comorbidities, the way you function in life, day-to-day life, stress, all these are very, very important. People wrongly presume that they do exercise for 2 to 3 hours, everything will be all right. It is not. Exercise is good for health, but only moderate exercise, maybe 30 to 45 minutes a day of aerobic exercise mostly. This is what is healthy for heart. But people who exercise in the gym, they think, oh, we are immune to heart problem because we are exercising daily. That is not correct. They may be smoking, they may be having wrong food habits, they may be eating a lot of preserved food, preservative induced food, junk food, and all these things which can cause a lot of heart problem. They may be having family history. They may be genetically more susceptible to heart problems. These are all the risk factors that play together to cause heart disease. So even if you're going to gym, working out, you still need a heart checkup.
That's absolutely correct. So what we see as a glamour is not necessary that people don't have stress. Stress is very important, and there are certain techniques to reduce that stress. And the most important thing is reaching out to the right doctor at right time. And the other question is how to differentiate between gastritis and heart issues. This is really alarming, and this is very increasing, and people just continue taking antacids and sometimes ignore also. We really lose patients because of this thing, and sometimes it's very difficult to explain to people that even they are in 20s or 30s that they can get into heart disease as well. Any advice for them?
Differentiating between gastritis and cardiac chest pain sometimes can be difficult. Both of them can have upper chest pain, middle, central chest pain. But gastric symptoms, they'll have more abdominal distension, they may have burping, they may have recurrent episodes of gastritis. Chest pain, it could be, because chest pain that's related to the heart is usually central chest pain. It is compressive in nature. It radiates to throat of the left hand, and there is profuse sweating. And generally, the people feel really sick when they having a chest pain that is related to the heart attack. However, just to be clear, you cannot 100% based on symptoms differentiate between gastritis and chest pain of the heart. You have to get to the hospital, take an ECG, should never ignore these symptoms.
So anything related to heart, the doctors are only saying that please reach to nearby medical facility. Better
Right.
is to reach to emergency hospital rather than medical centers. Whenever it comes to heart, we need to have full-fledged team, established team, where an emergency doctor can check, and then of course the cardiologist and a specialist and our surgeons can take immediate role because time is everything. So if we can, without checking on Google and without asking our relatives, wherever you are, if you are in a position to reach the hospital, reach. If you are not in a position, ask someone to help or call the ambulance. We are living in a country which is very helpful, and ambulance reach in a few minutes at your doorstep. Immediately go to the hospital, and it can change life. Saba, one important question, since we're talking about blood pressure as one of the most important risk factor for getting into heart diseases, what does salt play? What is the role of the salt in blood pressure and heart disease?
See, salt. In today's time, we have often seen now, people are taking a lot of salt or sodium laden food. So, salt and sodium, two important criteria. So, we don't really overeat salt, but we eat a lot of sodium in the food, in the diet, and which can be a leading cause for hypertension. And like, as we know, that hypertension or blood pressure is a silent killer, so it is doing it work slowly and gradually there until we really realize that what has happened. So often people who are having cardiovascular disease could be having some comorbidities associated. So if you're having high amount of salt or sodium weighted food, you could be at risk of stroke, you could be at risk of kidney diseases, edema, fluid retention, and so many other factors. So hence sodium and heart relation is very close. Whether I mean, if I have cardiovascular risk or no, whether I am in that age criteria or no, by default we should restrict on the amount of sodium that we are taking in. We should restrict on the amount of salt that is being put on the table apart from the regular cooking. Okay, any table salt additionally in salads and preparations, etc., should be taken care of. It is very important, as dietitian, we would like to educate patients to read the labels. Whenever we are buying a product, we only see the price tag or the brand of the product. Please go ahead and read the label. It is really cholesterol free. It is really sodium free. It is really does not have salt. Often patient, they will take products which are low in salt, but probably it is high in potassium. So that could be another, area which we need to be addressing, because hyperkalemia again could be a risk factor in certain conditions. So yes, salt is very important. It plays a very important role, and whether it is a child, an adult, middle age, women, men, we should be very strict with the sodium and the salt consumption.
Thank you. Dr. Jeboury, I have a question since we talked about surgery happening, and now we have put the stent and patient has gone happily home. So he is now on blood, he's on the medication. So is he going to be lifelong on the medication now?
That's a very interesting question. The most important thing, when somebody comes with a heart attack, he will stay in overnight in the hospital. The maximum time you spend with him is like 1 hour or 2 hours. The visit to the clinic is vitally important to adjust all the things later on. Now, regarding the medication, we have to discuss about the medication, the lifestyle, the exercise, and everything. We have to address step by step. Antiplatelet has to be continued for a lifelong, at least one antiplatelet. We do have now very potent antiplatelet. Most of the time, we can continue on them 6 to 12 months, but afterward, he will probably go only on a single antiplatelet. And now it's very extensive study, which is one that's preferable. We have to continue reducing his cholesterol. And we have to be sure that a lot of people, they are coming after the procedure. He said, my bad cholesterol is very good. It's similar to my brother, but it's totally different. Every single person who has angioplasty has a different target of cholesterol. The only way to remove the cholesterol is by treating that cholesterol, by reducing it to the level that it will be probably cause some regression to single extent. It's not a good idea just to have removed without a treatment, and then the cholesterol will pop up in front of the stent and will go again into another stent, into another stent. So we have to control the cholesterol, is vitally important. We have to continue with single antiplatelet. We have to go for the risk factor. Sugar has to be addressed very carefully. Blood pressure has to be carefully, because it is the risk factor modification. It will be the major thing. We fixed an artery physically. Physically, it's just push up the cholesterol on the side, allow the blood to go, we preserve the heart, we save his life. Unless he actively involved into risk modification, cholesterol control, and some tablet, the procedure will be again, he will pop up in the emergency after a couple of months or a couple of years. So he should address the risk factor carefully.
Thank you, doctor. Just a question out of the curiosity, and a lot of people ask. So, once a heart attack, that means a risk for another heart attack anytime, even if he is on better lifestyle.
This is the very important question, is that, let us first know very important fact, that the intervention is a major step in the history of cardiology or even in medicine. It is a process which has reduced the acute mortality from something around 40 to 50 to less than 1%. But does it involve the pathology? No, unless we are going to go with the pathology and treatment and treat the risk factor, the recurrence rate, like it's still there and it's up to 20%. And it's up to 20%, the risk is popping up. Let them understand that we did not remove the cholesterol that blocked the artery. We did not remove the calcium that blocked the artery. We treated a critical artery just by pushing aside everything to the wall and letting time for the blood to flow, allowing the time for the medication to resolve all this process, leaving the treatment with stent, like we are seeing very commonly actually, and sadly we are receiving a people, just stent, and then he came in the emergency after 6 or 7 months, another attack and another attack, and that's really very sad. We have to address the risk profile, otherwise it will be another process going on.
Thank you, doctor. On that part, Dr. Suma, now this patient who has had one heart attack is coming for the follow-up. What are the do's and don'ts over the period of next 1 year? He's expecting cardiologist, and we expect his adherence. What is the protocol need to be followed?
Yeah, once somebody has had a heart attack, he has been treated. Now his risk factors are controlled. He's on medication, and he comes for a checkup. The thing that we concentrate on is getting him to the normal lifestyle that he's had before the heart attack. That is very important. The quality of life is very important for anybody, as much as quantity of life. So the thing to do is monitor his blood pressure, how well he's coping with the medicines, what are the side effects that he may be experiencing. We might need to optimize his medication, make sure that he's feeling all right, then get him back to cardiac rehabilitation, that is getting back to exercise, start slowly, graded exercise, probably work with a physiotherapist or something like that. Then stress on his diet, very important. Diet for me is, as Saba was saying, diet is very important for me. If younger patients or older patients, I would restrict the salt, I would restrict the amount of fat. The younger patients, the most important thing to do is take away chemicals from their diet. The preservatives, junk food, these are the things that causes reactive hypertension and endothelial dysfunction and heart blocks in younger population. So it's very important that they eat and cook with freshly cooked food and with good oils like olive oils and things like that. So these are very important. The diet is of paramount importance. If they do not control the diet, they will end up with a second heart attack. And that's what you were asking. What is the risk? The risk definitely is higher for a person who's had a first heart attack than a person who's never had a heart attack. So these are the things that I would concentrate on.
You're muted.
So thank you, Doctor. Now, Saba, challenging situation for you. Now, this patient who was obese and he is a smoker and he has a couple of parameters of cholesterol high. Now, we want him to consult a dietitian. How will you start approaching and how he should go ahead further down the line for 6 months and 1 year? What is will be your approach in a case of post heart attack who is obese, who is smoker, and whose lifestyle is just sitting lazy, of course, because we are on chairs most of the time. So how would you address this whole concern?
See, we often see such type of patient who are obese. Okay, they lack physical activity. So and they are taking medications and they visiting their doctors, but they are failing to continue the lifestyle changes, diet and physical activity, and sleep. I really stress upon sleep pattern is very important. And while we were talking about the young, the earlier part where we were talking about the younger generation going to the gym and everything, I think we're forgetting to see that they are not sleeping well. The generation of today, even people in early 30s and 40s, are using their screen time is increased. They're not sleeping on time, so the entire the circadian rhythm is affected. Now, when such type of patients come to a doctor, it is very difficult. See, it is easier to pop in pills than follow a diet and a lifestyle, right? It is easy, right? So it is very difficult for us to make them understand. But while through counseling sessions, 1 to 3, 2 sessions or 3 sessions of with follow up, we have to structure their diet in a funnel approach. Okay, initially we cannot keep on cutting everything. Then the person feels that I am on a boring diet, and the deprivation will cause anxiety, depression, and other psychological issues. So, what the first and foremost thing is identify what is the type of food the person is eating. They stop fat. Now, they're very confused when it comes to fats and diet and heart attacks. They think that I should not be eating fat at all. So, some overdo and they stop eating fats at all. So, now in the bargain, they're missing on their healthy fats. So it is important that you consume fat, but in the recommended amounts. And the healthy fats, which is more important, should be consumed because they have antioxidants and they are protecting your heart. They are having anti-inflammatory properties. And so while we're doing the consultation, we explain them about the type of fats which are important. To control on your weight is also equally important. Now, having said that, we have patients who are young, I mean, lean also and having cardiac issues. So, but if he's an obese, he has to definitely look into his weight pattern, not only through diet or restricting on food, but following a balanced diet, which all the 5 food groups coming into play and with physical activity. If he's obese, he cannot walk. If he has any ortho problem, let him walk for 15 minutes, 20 minutes. See how many steps I'm walking today. If I'm walking only 2,000 steps today, tomorrow 500 more, another day 500 more. Gradually increase the step. We cannot push on things on them, and gradually I'm sure after a month or 3 months they are in place, and with medications, proper lifestyle and dietary approach, we can come overcome the battle.
Thank you, Saba. Honestly, it's a just enlightening session, and I'm learning a lot. And I'll just go back to where I started because as we are proceeding towards the end of the session, is something called prevention. So you have a link in the survey, and what is this? I would like to explain to you. It's a kind of win a complementary artificial intelligence (CVT) heart health risk analysis, which can provide you the report. Imagine having a personalized roadmap to a healthier heart. This dream can become a reality with our groundbreaking artificial intelligence CVT health test analysis. It goes beyond the basic, offers a personalized risk score for CVD events. This comprehensive analysis paves the way for tailored preventive measures, putting you in control of your heart health. Why early detection matters? Because whatever we talk here, you have two options: either go for early screening or treat the disease. Why not to opt for the early detection? So Prime in the month of September has given this opportunity to everyone who would like to know more about their heart. In the current era, your journey to heart health begins when understanding your unique risk profile. This knowledge equips you to tailor your lifestyle choices with the dietitian for optimal heart health with the cardiologist. It's time to move from reacting to heart issues to proactively safeguarding your well-being. So link is on the screen, and with that, I would really like to ask my speakers today to give their takeaway message as we are almost 2 minutes away from ending the session. Dr. Jeboury, please go ahead with your take-home
Thank
message for all our
you.
viewers
Thank
today.
you very much. Thank you very much. I would just give a final message, simple message. There has been a lot of work of improving technique, tools, genetic modification. We have heard the genetically modified pig hearts inserted, artificial heart. I'm telling you, actually, this is going on. It's going on. But you know what's the cost of this improvement in cardiac care in the United States, 2017? It's $300 billion. Do you think any economy can tolerate that for a long period of time? I think it's time that we should go back. Instead of going for angioplasty and stenting, let's start with a healthy diet, please, check up, control the things at an early stage. I don't think no economy can tolerate any further expansion in sophisticated things. There is artificial intelligence now going on. There is genetic modification going on. There is stem cell modifications going on. But I think it will always reach to an endless road. We should go back to the basic route, try to improve the health, early detection, checkup. I think this is far more better for the person and far more better for the country. Thank you.
Thank you so much, Doctor. Dr. Suma, please.
I think I have a very short takeaway message. Don't wait for symptoms. Get your heart checked today.
Thank you so much, Doctor. You are absolutely on the spot. Saba, what's your message for the
There is
people?
no superfood. There is no super diet. There is only a good diet, lifestyle, and as doctor said, go back to your roots. Go back to your roots and try eating the regular healthy foods which our grandparents ate. Do that much of physical activity. Take care. We are blessed with a beautiful country with best of the medical amenities. Go ahead if you have any problems. Don't stop. Don't do home remedies at home.
I would like to share the outcome of the whole program, what I've learned today. The most important thing is that heart disease can happen at any age. Do not ignore your body symptoms. Do not go for over the counter medications. Whenever you feel any kind of symptom, it's the body telling you that something is not correct. You need to go to the doctor. Do not wait, in specifically in heart cases, do not wait to take opinions from friends or relatives. Go directly to the emergencies and get your heart checked. It's with the basic test you will immediately get to know whether this is heart attack or anything else. Spend that time, and most importantly, for all age groups, if you are alhamdulillah not into any heart disease, use preventive health screening programs. It is for you, it is important. However you do, wherever you do, if you are diagnosed with any disease, follow and adhere to your doctor. Do not jump from one doctor to another. Try to remain on one doctor so that your doctor can tailor your all health routines, because he's the one who knows how to change. And don't Google. So doctors have long history of education. They are experts. They are the right one who can treat you. And with that, we hope that you are going to live a long 100 more years, and happy World Heart Day to you. Next webinar is about breast cancer awareness. Do remain in touch. If you have any feedback, suggestions for us to improve, we'll be there always with you. Thank you and have a great evening ahead.
Thank you.
Thank you very much. It's an honor. Thank you.